Hi, I'm Teepa Snow, and I'm considered a master educator in the world of dementia. And today we're going to be talking a little bit more about continence, incontinence, and I'm going to focus in on time of day and interventions. So time of day does matter when it comes to continence, incontinence. If we think back to childhood, remember that kids often develop continence during the day, well before they are continent through the night. So it is important to recognize, that may disappear in maybe the opposite direction. It could be that we have people who can be continent in the day and have problems with continence or become incontinent at night. We want to make sure that we're taking into account sleep, skin care, and incontinence. It's a combo. So during the day, if I have someone who's living with dementia and is not really liking too much intervention when it comes to incontinence support, and they need some incontinence support in the day, then having a product that really doesn't require quite as much intervention might make a difference.
So both these products are designed for someone who's my size, medium, more or less, and they're designed to fit. So let's look at this one. It's got a nice fit. It's relatively tight. It's got the leg holes, and it's got an insert for sure. It's got a front and a back. And so if I have just a little bit of urine coming out and I get changed immediately, probably not a big deal. But if we have someone who really doesn't like to get assisted with incontinence care, and yet we want their skin to stay healthy and we want them to have less intervention episodes, which triggers so many other problems for someone, then let's take a look at the SENI product. Here we have the same product. Now, fit, yep, but here's where it gets special. Take a look. We have an outside protective that fits around the person. Now, this is air permeable. Inside, we have a second fit. This is what holds the pad up separate from the undergarment. And we have an incredibly hydrophilic inner lining. And check this out. It even has an area here, which females have narrow areas, and then we have wide areas. So it has a nice big area for collecting urine here and a nice area here for collecting urine as well. I'll be able to go longer and sleep better. I'll be able to go longer and have fewer episodes of needing assistance to be changed. And the product that's used wicks the moisture away from my skin and into this product. Really cool.
Now, I want to get into it a little bit more here because I want us to realize daytime, nighttime. Turns out that human beings produce more urine frequently when they're sleeping or lying flat, and that's just because the kidneys are often working better. So what I'm going to demonstrate is this idea of absorbency, fewer changes, because these products, the SENI products, are actually designed with skin protection in mind, wicking away and chemical balance, so that odor is controlled and so is the ammonia content. So it's not as rough on the skin, and there are skin barriers we can put in place. Now, here we go. What we're going to do is compare a more typical product with a SENI product designed to stay in place for the night, and we don't need to disturb sleep. We can let people, if all they do is rouse enough to pee, let them pee and go back to sleep, rather than having them pee, then having us interrupt their sleep with changing, particularly if they don't like that anyway. All right, so what we'll do is we'll try the SENI product. Now, what's going to happen classically is people put out a cup to maybe 2 cups of urine at a time. So my assistant here is I'm going to hold the pad, and they're going to put out about a cup or 2 cups. And I'm gonna lift the pad. That was quick. Totally absorb it. So it goes by another hour or two. Another cup or 2 cups. And you notice again, still there and relatively dry. Ooh, now let's do it again. Oh boy, that was a big one. Woo-wee. Now, oh, maybe it's time for a change. But if that's happened every 2+ hours, we're talking good 6 hours of sleep, maybe even 8. Let's see what happens if we try a less wonderful product. Here we go. 2 cups. Oh dear. Yeah. So we're going to have issues. More? Oh dear. No, that's not good. So what does that mean? Yeah, it means we're going to have to intervene at night. And it's not going to be just once in a while intervening at night. We're going to have to do it every couple of hours. And when we do it, the person is very likely to have been uncomfortable. And when we're intervening, we're going to make them more uncomfortable. So the message for today, thinking about what we use when and matching up with the absorbency needed for continence promotion, incontinence management, and recognizing, boy, I could get a lot more sleep and be a lot less distressed at night if I had a product that could stay in place and I could sleep on and you could work on.